We have Dr. Sanskriti Sasikumar. She's an assistant professor of neurology at the University of Toronto, so evidently she has a higher tolerance for cold than I do. She has a special interest in gait and cognitive disorders and Parkinson's disease and is completing a PhD in the rehabilitation of balance and freezing in Parkinson's disease. Her research has been funded by the Canadian Institute of Health Research and Parkinson's Canada. Thank you so much for being here today.
Thanks so much for having me, Eden, and everyone. Hello, everyone. That was a very kind introduction. I'm actually going to be talking to you about exercise and Parkinson's disease, and I can't take any credit at all for this very catchy title that I have here, Working Out Symptoms. But basically, what I'm going to be talking about is the impact of exercise in Parkinson's disease. So, um, I'm to understand that much of the audience is either, individuals with Parkinson's disease or caregivers for people with Parkinson's disease. So I'm going to just go through a few introduction slides that you've probably heard quite a bit from all the lectures that you've attended previously. But we often think of Parkinson's disease as just a problem with movement, but it's so much more than that, as it has what we constitute as non-motor symptoms of Parkinson's. And this can actually have quite a profound impact beyond the motor symptoms themselves. And as a disorder of movement, it can impact things like tremors, it can cause stiffness, slowness of movement, balance problems, but also these non-motor symptoms that I was referring to essentially refer to symptoms such as difficulty with regulating emotions, whether or not it can be associated mood or mood disorders like depression or anxiety, fatigue, apathy, poor sleep, and cognitive impairment. And really, the role of exercise comes in because the treatment landscape at the moment is very limited. So we don't have any disease modifying therapies for Parkinson's disease. And really, the treatments that we do have in place are very much geared towards improving the physical symptoms, so the slowness and stiffness, and actually not so much even the balance or freezing issues. So even in terms of the treatments that you're probably on at the moment, a lot of them are treating very limited list of conditions that are occurring as a consequence of your Parkinson's. And so there's a really large series of symptoms that are really untreated given what we have on the market at the moment. And so you've probably heard this quite a bit. So exercise is good for brain health, and it is true. This is why we say it all the time. And specifically so when you have any type of neurological disease, including Parkinson's disease, the benefits to Parkinson's disease in particular are to do with improvement of a lot of the physical symptoms, which are probably the most appreciable to the individual who essentially engages in an exercise routine. You have direct improvement of tremor, slowness in movement. And as a consequence of doing that, and I think I'm going to touch on this later as well, is that it allows us to keep the medication on the lowest, most effective doses possible because it naturally improves a lot of the slowness and stiffness that the medications would also otherwise treat. But the benefit of exercise is that it's able to manage a lot of these non-motor symptoms as well that I discussed. So fatigue and sleep problems and cognitive difficulties. And I'll talk about that in a little bit more detail in the coming slides. So at the root of it all, the benefits of exercise lie in its in a very biological change that it has on the brain. So it inhibits oxidative stress, repairs mitochondrial damage, and promotes a lot of growth factors that are actually very important for maintenance of brain function, including brain plasticity. And so the other benefit that it has, and the other reason why we recommend it, is beyond the treatment of your Parkinson's disease itself, because often a lot of the disability that people tend to accumulate while having Parkinson's is due to the concurrence of comorbid disease. And this is things like blood pressure, diabetes that are otherwise very common in the general population. And so engaging in an exercise routine can actually help lower the risk of developing these diseases. And if you already have them, then manage them very well. And so it's especially important in order to engage in exercise, as it can be very protective in many ways. And really, the research comes out of a lot of power-based resistance training, showing significant improvement in the motor symptoms of Parkinson's disease, particularly with reducing the slowness. And a lot of the research looks at UPDRS scores, and these are essentially formal scores, as I'm sure you're probably aware, that essentially help us give a numerical number to the severity of the constellation of symptoms that you might be experiencing with your Parkinson's. And so there was an overall reduction in these scores after exposure to power-based resistance training. And as I'll kind of discuss later on as well, there's a lot of heterogeneity in terms of what exactly constitutes exercise. And so we'll kind of talk about how to navigate that from a practical perspective. Now, the impact is primarily on motor function because it improves things like posture, balance, walking speed. And in doing all of that, it actually reduces the falls in Parkinson's. And falls are quite a significant thing that we worry about, because it could really put people back in terms of what they're able to do from a physical perspective. And so a lot of it is prevention. So preventing falls, and exercise is one of the good ways in order to prevent falls. Because of its consequence of improvement in balance, particularly. And so its impact on cognitive symptoms is also fairly notable. So about 50 to 80% of individuals with Parkinson's disease eventually develop memory problems, whether or not that's often in the initial disease stages. It tends to be kind of slowness in thinking, difficulty kind of remembering that name of the actor that you saw on TV. But the longer you live with Parkinson's disease, the more likely you develop a little bit more prominent symptoms of memory problems. And so essentially exercise can actually improve that quite a bit, because it slows down disease progression from that perspective. And the studies that have looked into cognition and exercise have predominantly been in the form of dancing and treadmill training. And they've essentially shown that it promotes cognitive function. In doing so, so what type of cognitive function? It's mostly attention and executive function. And so those were the predominant domains of cognition that showed improvement after exercise. And sleep is another thing that exercise improves. And it's an important thing to recognize, because sleep disorders also affect about 80% of individuals with Parkinson's disease. And this can range from a whole series of symptoms: insomnia, just difficulty falling asleep, staying asleep, restless legs, which can further drive the difficulty falling asleep, what's called REM sleep behavioral disorder. So this is essentially acting out your dreams at night, like you're in a fight with someone, or loud vocalizations of yelling and screaming, and that can often cause a lot of sleep disruption as well. And also excessive daytime sleepiness, independent of all of these symptoms. The other thing that drives the difficulty with sleeping in Parkinson's disease is the medications that you tend to be on. So a lot of the dopaminergic medications, especially higher doses of dopaminergic medications, meds like amantadine, can cause difficulty falling asleep as well, which can further drive the issues with this. And so where exercise comes in is that it improves sleep efficiency and sleep time, perhaps because you're just working during the day and kind of exhausting yourself from the physical perspective, that you actually make yourself more likely to fall asleep at night. But exercise also reduces the duration of REM sleep as well, which reduces the likelihood of these breakthrough episodes of dream enactment behaviors that you might have. And so much better option than medications, which a lot of people tend to essentially accumulate as a consequence of these symptoms. Exercise improves mood. So essentially up to 40% of individuals experience issues with depression and anxiety. And these are individuals with Parkinson's disease, sorry. And anxiety, it's important to recognize that and address that, because anxiety as an independent factor can further perpetuate your walking problems, especially if you have freezing, because you tend to get into a bit of a vicious cycle where you freeze and then you tend to get anxious, and that tends to make you freeze a lot more frequently, and that can increase the risk of falls as a result. And so another important reason to manage anxiety as an independent symptom. But it's been shown that exercise was equally effective for depression after about 16 weeks of treatment when compared to medication therapy. and people who didn't show any improvement after using antidepressants, which can sometimes be seen because you often need to try a few different medications, like a few different antidepressants in order to see which one suits you best. But either way, people who didn't show any improvement with that alone felt much better after aerobic exercise. And this constituted about 30 to 45 minutes of exercise about 5 days a week. The other benefit of exercise in terms of the other non-motor symptoms is really in terms of improving fatigue and constipation. So, exercise just naturally facilitates movement, which facilitates peristalsis, which can improve constipation and generally gut health. And in doing that, because what tends to happen is with constipation, because you kind of get plugged up, it can affect the absorption of your medication. So kind of keeping a regular and consistent gut health would be very important. And so that's kind of where its role with improving constipation comes in, but exercise also improves fatigue and energy levels. And so it's also important to note, actually, and I kind of briefly alluded to this in some of the earlier slides, is that it affects how well the medication can work on your body. And I had mentioned that, but part of this is because it naturally improves a lot of the slowness and stiffness that your levodopa targets, but it can also help reduce dyskinesia as an independent, mechanism. So dyskinesia often tends to happen when you accumulate higher doses of levodopa, and so keeping you on the lowest, most effective dose is always going to be the goal. But exercise essentially facilitates keeping you on the lowest, most effective dose, but also it can help reduce levodopa-induced dyskinesia. And the reasoning behind this is theorized to be maybe because it helps restore normal kind of basal ganglia function. And I guess by consequence of its improving gut health, it also increases the efficiency with which each dose of levodopa tends to get absorbed and work in your body. And so this is a question I get asked quite a lot in clinic. So does the type of exercise matter? And I always preface this by saying that, like I said, like there's a significant heterogeneity in the studies that look into the benefits or the impact rather of exercise in Parkinson's disease. Generally, based on the literature out there, so systematic reviews look at a lot of the studies, look for a general consensus amongst many studies, and they've shown that there's a moderate benefit on movement with exercises such as dance, aqua-based training, gait, balance, and functional training. And there was a small benefit with interventions such as Tai Chi and yoga. But again, and like I think my next slide, perhaps we'll kind of talk about this, there's not only is there a significant difference between the type of exercises and the duration of treatment, the severity of Parkinson's disease and all these people, the other thing that impacts what these results say is what they're actually looking for in terms of what constitutes an improvement. And so this small benefit with Tai Chi and yoga doesn't mean that Tai Chi and yoga are bad. It's just that whatever they were looking at, it probably the motor symptoms, the severity of UPDRS scores was probably what was not quite as significant with these particular interventions. They didn't find any benefit with flexibility training, and aerobic and resistance training tended to be the ones that improved the non-motor symptoms.
Before we move on, on that slide, what is the gait balance functional training? What would be an example of that?
So this would be, so I guess in terms of, so balance and functional training would probably be like tricks in order to help, let's say, break freezing episodes. Balance and like a few other exercises to improve balance would kind of be the standing up and sitting down, really anything that works on your core. A lot of physiotherapists actually tend to do this. So I don't know beyond like what additional exercises beyond that, but those essentially are the types of exercises that would typically be geared towards improving balance and like just general function.
Okay, because when it
Yeah.
went through, I was like, well, I understand dance, I understand, water aerobics.
Yeah.
And then I was like, what would be like specific a gait balance, functional
Right.
training?
So,
What was
so I
that?
guess with gait well, with gait in general, there's a lot of the studies that looked into that was treadmill studies as well. So, to improve, like, so with gait and balance, it's mostly looking at walking. So essentially, like as opposed to, let's say, the stiffness or the slowness of movement. And so perhaps, like treadmill exercises would likely also constitute like gait training. And so does the type of exercise matter? And this is kind of where I mentioned that, there is a lot of variation in the protocols. And yes, they're using generic terms like, gait balance and, like, but what exactly do those involve? And that essentially can vary between each of these studies as well. And the other important thing to note and is that a lot of these interventions, like not all of them would have been done, let's say, like in a practical setting where they incorporate the type of exercises that you would typically do when you like with your routine workouts in a week, say. A lot of this would be specific interventions provided in a clinical environment, which might also play a role into what we appreciate as improvement versus lack of improvement. But I mean, I think ultimately, and I think I kind of mentioned. Yeah, so in terms of what you can actually be doing on a day-to-day basis, um, it would be incorporating about 30 to 45 minutes of exercise at least 3 to 5 days a week. And it's worth always talking to your physician about this. And the reason why I say that is because depending on people's age, their general kind of physical like well-being, what other kind of comorbid disease that you have. Let's say if you have a lot of cardiac disease, like sorry, a lot of heart disease or lung disease, or like a lot of like bone and joint issues. Like it can really vary the type of things that would be safe for you to do. Um, and so it's always kind of important to kind of run through with your physician what type of things would be recommended given your particular health. But on average, it's about 3 to 5 days a week for my more kind of like, because I mean, I see a whole range of people with Parkinson's disease, and some people who are very active or have always historically been very active. And I usually recommend that they try to maintain their previous level of physical activity. But for someone who's really never exercised like really a day in their life, I recommend something a little kind of slowly easing their way into it. But you want to do a combination of aerobic exercise and weight bearing. So aerobic exercise, honestly, anything that gets your heart rate up. So like a casual walk down your neighborhood is not really going to cut it, but it's either a brisk walk or walking on a treadmill on an elevation, like something that kind of gets you huffing and puffing. And weight bearing is always important, not only because, just as a consequence of aging, we tend to lose a lot of muscle mass, but also just in terms of like keeping up your strength and especially your core strength, weight bearing exercises can be very helpful. And it's very difficult to essentially really get into an exercise routine. I mean, let's be honest, if people are not like exercise is not always it's not fun for everyone, and it can be very hard to get into, but it's about really trying to be consistent as you can, and often trying to incorporate exercise into your day-to-day life. So whatever it is, like I often recommend that people like sit down, have a think about what type of movement brings them joy, whether it's like swimming or running or uh, going to the gym. So figure out what it is that you can do, and try to do that, like maybe starting off with like once a week, then twice a week, then 3 times a week, and kind of slowly building on that. But also just in terms of your day-to-day living, you want to be a little bit more of an active person. So try to take the stairs a bit more often. If gardening is something that you enjoy, try to get into that. Perhaps cycling to work or kind of doing chores around the house. Like you want to move around quite a bit. If you have a dog, then taking them on their walks is also good. Evening walks after dinner are always a good idea as well. Um, And so, these are ways that in which you can actually like incorporate movement into your day-to-day life. And again, I, I caution people to do review what you plan to do with your physician or your physiotherapist, because you really wouldn't want to be injuring yourself and doing a lot of these things within your physical limits, but also avoiding injury or falls. So we want to make sure that you're doing this in a safe way. And in terms of establishing an exercise routine, it's again, starting off with just small goals. So, like I said, getting and easing your way into it. So not right away going into a 3 to 5 day schedule of doing something physically active, but kind of being a little bit more forgiving in terms of easing your way into it, whether or not you want to build on increments of once a week or every couple of weeks, but essentially just slowly trying to kind of push your limit once you feel like you've reached a level where you're getting a bit too comfortable. It's always important to track your progress. Not only because you'll have a chance to look back and be proud of what you've done, but also to kind of give a sense to your physician about what it is that you're actually working on or working towards, and varying the exercises if you're not one to be a regimented individual who likes the same thing over and over again. Like, we're all very different people, and I know for me personally, doing something different all the time is way more exciting than doing the same thing all day every day. So kind of try to vary the type of exercise that you do, and I think that's become a little bit easier in this day and age with like ClassPass and a bunch of other exercise like studios like that tend to be propping up in your local neighborhood, or even like the different types of classes that they might offer at your local community center or your local gym. So doing this is much easier these days than I suppose it would have been like 10, 20 years ago. Joining a group class or exercising with a friend is always good because it tends to keep you accountable. And if for people who are a little bit more sedentary, and if you're not one to exercise, you haven't exercised in ages, I always, always, always recommend seeing a physiotherapist first, because they're amazing. I love our physiotherapists. They can really they give they do an assessment and they essentially give you a personalized recommendation about what you can do in order to slowly ease your way into into an exercise routine. And the other thing that they would do is essentially give you exercises to ensure proper form. And this is something that's especially important to my patients with Parkinson's disease, because they tend to kind of report a lot of kind of forward kind of bending that tends to develop either subconsciously or consciously. The other thing is a lot of the balance exercises that my slides had previously mentioned, a lot of them tend to require core strengthening, and there are certain exercises that your physiotherapist can work with you in order to improve your balance. And like I said, kind of standing up from a seated position is one of them, but they have a whole host of other things. But balance exercises, if you're someone to have noticeable difficulty with your balance as a consequence of your Parkinson's disease. And so working with them, what they do is they provide you with a series of exercises. How it works over here is when someone sees a physiotherapist, they get a few sessions and then that's it. But what they do at the end of the session, the physiotherapist would give you a list of exercises for you to do. And I recommend that people incorporate that in their routine exercise regimen for the week. So try to at least do the physio recommended exercises, which are not easy, but to at least do them like 3 days a week, or, if you're really good, then 5 days a week, because really those types of exercises are very much catered towards the kind of things that you need to work on your body. And there are lots and lots of helpful resources, and often it's just kind of knowing where to find them. That's the hardest part. I really like the Davis Finney Foundation because they have exercise videos on YouTube, but they also have on their website this giant PDF page that I don't that I fairly commonly print out for my patients, because it tells you exactly depending on your level of your level of exercise, if you're an active person or a more sedentary person, they actually have exercises that they recommend that you can kind of get into. So depending on where you're at in your physical level, they have a bunch of exercises that that they recommend for you. But there's also the Parkinson's Foundation, Michael J. Fox Foundation, that also kind of like have a very dedicated few pages on their website about exercise in Parkinson's disease. But probably one of the really cool things about Parkinson's disease that's really very much driven by people with the condition uh, who essentially live with it on a day-to-day basis is all these patient groups with that essentially where you can exercise. So there's Dance for Parkinson's, or in Canada, Dancing for Parkinson's. There's rock steady boxing, pedaling for Parkinson's. So really whatever exercise you enjoy doing, if you go online, you will find some exercise group that essentially with Parkinson's disease that you can join and keep you accountable and in your way. Dance for Parkinson's is great. I remember during my training, we actually did a class with them, and it's just like it's just such a great group of people, and really really important exercises that you learn is in a really fun way. And it's at the end of the day, it's always very important to connect with your community, because this is the hardest part with Parkinson's disease. It's almost like this feeling that you have to just withdraw, and it's very tempting to just not do anything, and that's mostly because of the apathy that tends to accompany the symptoms of Parkinson's disease, and not uncommonly the symptoms of depression and anxiety, and all of that can really risk you being more withdrawn from the people around you that could potentially support you and keep you kind of active. And I know this is easier said than done, but just recognizing or identifying who your community is and making sure that they're able to keep you accountable in terms of, if it's exercise or your medications or, your general well-being, or if you're someone who has a lot of mood symptoms, making sure they check in on that. So it's important to kind of identify your people, so to speak. And so that's often the biggest thing. And it's the same with when it comes to exercise. And it makes a massive, massive difference. Like I said, not only in terms of keeping you accountable, but also just in terms of your general well-being, living with this otherwise, chronic disease. But yeah, no, I'm happy to take any like specific questions to do with what I've spoken about so far. Sorry, I think I kind of
My
went
first
through that fairly quickly, but
Well, my first question is because I think that people sometimes need to be caught out. Can you tell when your patients have or have not exercised?
um, I I think it's that. So that's a bit of a harder question. I think what I can say, because I do see people at different stages, and often, they come to me at different times, and often with a different series of problems. So I think a fairer way to answer that would be, I can tell the difference between my patient population who exercises and those who don't. And there are many reasons for that. So often they're just in better form. They often, like, I'm not making adjustments to their medications as frequently, and they tend to develop a lot of the balance and freezing problems much later on than people who tend to be a lot more sedentary. And so that's a big that's a big piece of it as well. So and just in terms of the other issues, like I was saying, so like the mood and your sleep and all of those tend to be much less of an issue in my patient population who are engaged in an exercise routine. But I think probably the most profound thing that I've noticed in my practice is that it's just the physical well-being of these people. Like I said, the most important thing is that I'm not like increasing their dose every time I see them. And second of all, things like balance, and like anything that affects the middle of the body in Parkinson's. So your balance, freezing, speech, and swallowing, they tend to be resistant to your medications. And so no amount of increasing levodopa is going to fix that. So you really want to try and delay the onset of these symptoms as much as you can. And with exercise, like you're able to do that. Not so much the swallowing and speech, but certainly the balance and freezing piece.
I did put a few links in the chat for Parkinson's Wellness Recovery, for PD Connect, and for Power for Parkinson's, because you had mentioned Davis Finney and what they do, Rock Steady Boxing, Dance for Parkinson's, or Dancing for Parkinson's in Canada. So I do want to let people know of other things. So those are in the chat. We had one question about How does the neuro enter into OT and PT, as in neuroplasticity, building new pathways in the brain? Can you talk a
So
little bit about that?
I'm not sure I understand that question. Is it more plasticity in terms of how neuroplasticity happens as a consequence of?
Yes, I'm guessing because, like, with exercise, building new pathways in the brain, like how that does, like, exercise help with neuroplasticity, I guess.
Right. Yes, it does. It does help with neuroplasticity, but again, these are imaging studies that essentially show better communication between the neurons, not so much developing newer pathways that didn't exist before.
Mhm.
I think they're like it just promotes brain health in many ways beyond which we fully understand. And part of it is it promotes neuroplasticity and just like neuronal healing, the production of like good proteins, for the lack of a better word, and essentially like delays neurodegeneration from other causes. And so, because not uncommonly with age, like people develop Parkinson's disease, but can theoretically also develop Alzheimer's a longer, you know, like just as a consequence of aging. And so, in terms of promoting neuroplasticity, it essentially delays the onset of these other like these other potential conditions that can happen with aging by keeping the existing networks active as they should be.
Then we have this is a twofold question. Why do people with Parkinson's fall, and which exercises help prevent falls?
So there are many reasons that people with Parkinson's can fall. Often, and I don't want to discount medications here because this is always important, right? Because people might it's when you go see your physician, they will ask you a series of questions that give them an idea as to whether or not you're falling because your medications are not working well. Because often, the fluctuations that happen in between doses is something that can happen with that eventually happens with Parkinson's disease within a few years of you having it. But so if you're falling kind of during those periods where you're wearing off, then then your medications would need to be increased in order to keep you level. Because I roughly explain it as when you have Parkinson's disease, your brain's producing less and less dopamine with time. So when we adjust your medications, we're trying to essentially give you the dopamine in order to kind of give you some of that function back, whatever dopamine your body's not producing. We're trying to compensate for that by adjusting your dose. And so the falls can happen when you're wearing off often. The falls tend to be usually, because people might experience more balance problems, more freezing during wearing off. Um, or if, let's say, like you have more left-sided stiffness compared to your right side, a common, like a like a common symptom that I hear is, oh, I kind of, I feel like I'm dragging my left foot, or when I'm climbing up the stairs, like my left leg's just not moving as well as my right. Or, often the curb is just like a notorious place for injury for a lot of people. And so it's often like, tripping on the curb of a sidewalk. Again, because the side that's more affected with your Parkinson's might not kind of lift up as much. A lot of the balance problems tends to happen in small spaces. So like in the bathroom or in the kitchen, kind of when you're making a lot of small adjustments to your walking, or during episodes of freezing as well. So freezing is, you often tend to shuffle, 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 and then kind of freeze. And it's almost like your brain wants to move, your body wants to move, but your feet just are stuck to the ground. Um, and again, this is kind of where physiotherapy is helpful, because what they do is, because when you tend to fall, especially during freezing episodes, if let's say that is treatment resistant, so resistant to either medication adjustments, if you have DBS, then DBS adjustments, then what a physiotherapist can teach you cueing strategies or visual, like using either visual cues or auditory cues, or like in order to essentially overcome your episode of freezing, like things like marching in space, like in place, can actually help as well. So there are lots of those strategies that can also help when you speak to your physiotherapist. But freezing is another common time that people with Parkinson's tend to fall. Trying to think of what else. Oh yes, another important thing is when you have Parkinson's disease, you have a lot of autonomic dysfunction. And so your blood pressure tends to vary quite a bit, especially so when you stand up. So normally when we stand up, our blood vessels tend to squeeze in order to keep our, keep the blood within our heads. But often that's a bit more of a sluggish response when you have Parkinson's disease. And so your blood pressure drops when you stand. And so that's another, somewhat common time that people tend to fall because they become dizzy upon standing really quickly and then they fall. And so that's like, again, if what would happen, how your doctor would determine that is by measuring your blood pressure, or how you can, if you have a blood pressure machine at home, is measure your blood pressure sitting down and then after standing up. And if there's a significant drop, then bring that up to your doctor.
And we have a question. Is it important to get the heart rate up to a certain number?
Not, I wouldn't focus too much on numerical values of what you need to get your heart rate up to, because a lot of that is dependent on what your baseline heart rate is. So, and that varies in different people. Just your normal baseline heart rate can be very, very different. And so if 90 is like a lot for one person, that might not be enough for someone else. And so I would not really look at that as a measure necessarily, but more so like, are you feeling like out of breath and fatigued when you do that exercise? So kind of when you're running, or like, I hope I'm kind of giving a sense of what it is that I'm trying to refer to. So let's say when you're climbing up a hill and you kind of get out of breath, and you kind of feel your heart pumping in your chest, like that's the level that you want to reach several times during that 30 to 45 minutes of exercise. So you don't necessarily have to stay there for 30 to 45 minutes, but do some kind of exercise that'll get you up there often enough.
And then, what are the dangers of regularly low blood pressure?
So there's a lot of, um, well, it depends on, like, I guess, the causes of that. So with Parkinson's disease, what I worry about when people have low blood pressure, especially what I was saying, low blood pressure when you stand up, which is a condition known as orthostatic hypotension, is not only that it increases falls because your blood pressure dips quite a bit, but also people with low blood pressure, especially upon standing up with orthostatic hypotension, tend to manifest with memory problems much earlier than people who did not have that. So if that is something that you experience, it's something that needs to be treated. And it's, when I say treated, I don't mean like with medications. Like, so you shouldn't, like, the treatment's not often like throwing meds at the problem. Like, if you have low blood pressure, you want to be making sure you're drinking lots of water, but also having salt in your diet. So often, like, for the longest time, when for the longest time you're being told, oh, stay away from salt because it increases your blood pressure, but it increases your blood pressure to a good point in Parkinson's disease. And often people who have had high blood pressure for many, many years as a consequence of having Parkinson's disease, and also the medication that you end up being on, your blood pressure tends to go down naturally. And so you can afford to kind of add some salt to your diet. But again, discuss it with your physician. But generally, when you have low blood pressure, you want to add like salt to your diet. So whether or not it's like, adding physical salt in your food if you don't use any at all, or cooking with those, those oxo bouillon cubes, like, so you get that at any supermarket, like or like or broth, Campbell soup, anything that's really salty, having a packet of chips, like, twice a week or something. So you can do things like that in order to essentially get your salt up. But the other thing is also drinking cold water, which is a fairly simple thing to do. So drinking 1 to 2 glasses of cold water either early in the morning when you just get out of bed, or like before meals. So for people who have really low blood pressure, I recommend drinking cold water, like 2 glasses of cold water, like ice cold water, before they eat something. And that's often because after meals, our blood pressure tends to go down even more. And so that's usually when you tend to get even more dizzy when you stand up, and so those are the times that that you would do that. And the other thing is, compression stockings, whether it's abdominal binders, all of those tend to be a little bit uncomfortable, but also kind of a simple thing like adjusting your position slowly. So when you sit up, take a minute. When you stand up, take a minute, and only then start walking. Because often, it's that rapid changes in position that tends to kind of dip your blood pressure quite a bit. The other thing that I forgot is, again, on the topic of food, having smaller, more frequent meals rather than like large meals. That essentially dip your blood pressure quite dramatically, as opposed to smaller, more frequent meals, which tends to keep them a little bit more level even after eating. So, but that would be something that needs to be treated. And even despite all of this, if your blood pressure is low, which in a good 50% of people with Parkinson's disease, they eventually accumulate medications for their blood pressure to keep their blood pressure up, then you would, then your physician would essentially start you on medications for it.
And then you did touch on this in your slides, but they always talk about how exercise makes us feel better endorphin wise. So does
Mhm.
it kind of improve mood? Like, do you notice maybe less anxiety, less depression?
So yes, and not only because so it's never an immediate like change. Well, although after exercise, after you get into the rhythm of it, it can cause some immediate benefit, but it also causes the long-term effect on anxiety and depression tends to take a little bit longer, and we're talking several weeks of a consistent routine of exercise. Um, the reason why I recommend it highly is because often with any mood disorder, it's not medications only. There's a series of events that you essentially recommend in order to treat those conditions. And it's often non-pharmacological strategies. So things like cognitive behavioral therapy, exercise, mindfulness, those techniques, because that essentially gives you strategies in order to manage your symptoms in the long term, because all of these are variants of normal human emotion, but just a little bit more pronounced when you have depression or anxiety. But those strategies would be very important because medications on their own might not treat the symptoms adequately enough. In fact, with medications, some people might not like it at all because it really just blunts your emotion, and that's not always a good thing to experience either. So often with the management of mood disorders, it is, like these non-pharmacological techniques, which includes exercise and medications. And as I was saying, I think I kind of mentioned it briefly in my slides, even the type of, let's say, SSRI or SNRI that's often used in order to treat depression and anxiety, you might need to try a few different ones because the one that you're on, let's say if it doesn't work at a dose that it's supposed to do something, then it often warrants trying another agent. And so this is kind of why exercise can be very important to manage mood as well.
And then you also talked about how it can help with sleep. And I've actually said to
Hmm.
people that I think if you don't do enough during the day, then you're really not tired versus
Right. Yeah,
ta-
and that's actually a really good point because again, part of Parkinson's disease, you tend to you can have excessive daytime sleepiness, you can have low mood, but also the more sedentary you are, the more likely you're also bound to nap during the day, and so that can also affect your overnight sleep. And so it's important to kind of be physically active for that reason as well, because it's essentially gets you physically exhausted to the point where your body is also ready for sleep. But sleep is also just so complex because there's so many things that play into it. So also, like if you're not like sleeping during the day, which often tends to be a consequence of poor overnight sleep, but you really want to make sure when you're implementing a good sleep hygiene by avoiding naps during the day, making sure you're avoiding caffeine and like I guess any type of screen, not only phones, but also, TV and things like that, like in that 1 to 2 hours before you go to bed, coming up with a nice wind down routine, whether it's a warm bath or some chamomile tea or whatever it is that kind of calms you down. Sleep podcasts are also really great. So, there all of those things can essentially help you sleep better overnight. That can inadvertently also give you a little bit more energy to exercise during the day. But this is never, all of these changes are never going to be seen like right away. You really need to be patient with yourself and be really forgiving with yourself because um, it is something that takes a few weeks actually to implement. And this is with people who, like, even in people who don't have Parkinson's disease, who don't have a physical limitation in order to get into a physical, to get into an exercise routine, it can take forever. So, you should really, really just be forgiving of what you're able to do. And this is kind of where your community comes in, having people who are there to constantly kind of help you work through the difficulties that you're having in engaging in an exercise routine, and as well to, keep you engaged once you actually get into it and keep you encouraged as well.
and then you had kind of talked about in one of the slides, how like Tai Chi and was
Hmm.
minimal. Um, but I assume you would say any exercise is better than doing nothing, but also are there any
Right.
types of exercise you would kind of maybe recommend staying away from that you would say,
Yeah. So often, and this is kind of why I, well, subtly rolled my eyes at the lack of improvement of Tai Chi and yoga, because I do think it is very helpful. And actually, when my patients with Parkinson's disease experience balance problems, I actually strongly recommend Tai Chi and yoga, but yoga with, because it's different types of yoga. So you're really doing yoga with core strengthening, not your weird like asanas where you're kind of twisting into weird positions. Like that's not really beneficial, but you really want to do core strengthening exercise, yoga, but also like really core anything that that encourages core strengthening. Tai Chi is actually very good. Like it's a great exercise, and you're doing it in a group a lot of the time as well. Which so like I always recommend Tai Chi. But and they're like at least over here. I mean, granted, in Toronto, there's so many places where people just do Tai Chi in the park. I think it's particularly common in the city. But yeah, no. So I do think they're very helpful in terms of what exercises to stay away from. I don't know that there is anything that's like useless per se. But one thing I often have people tell me that they constitute as exercise is just stretching exercises, and I think that's a bit of a cop out. Um, because there is a little bit more that you can do. Like stretching exercises are important for many different reasons, because especially in people with Parkinson's disease who experience dystonia, I think stretching is very, very important. But also stretching in Parkinson's disease, any of the slowness and stiffness, it really just helps kind of stretch your muscles out and really um, treat any discomfort that might arise from that. So stretching is good, but don't only stretch, because that's not really when I talk about exercise, I don't mean stretching. I think I count stretching as separate from exercise. So that would maybe be the only thing.
And then one thing we hear a lot, and somebody actually said that she was a physical therapist, and she said you can take snacks, exercise snacks is what she called it, because sometimes it is hard to do a workout for 30 to 45 minutes. And like, could you
Right.
do 5 or 10 minutes here and there multiple times a day instead? Would that still be okay?
Right. I mean, and I think this is where it differs in different people. So I think it would be important to do at least 30 to 45 minutes. Like I think there's what a 30 to 45 minute exercise provides you is very different from what your like exercise snacks, I suppose, with your 5 to 10 minutes here and there would benefit you. So I do strongly recommend doing the 30 to 45 minutes, because that's a little bit more committed and you're working on your exercise. But like it's also important to stay physically active. So those exercise snacks to me count as just being physically active as an individual, like, not taking, like if you're able to, again, very much dependent on if you're able to try to take the stairs, try to walk to, your clinic appointments, or, things like that, that would maybe count as an exercise snack, but, you know, um, it is more incorporating exercise into your day-to-day routine.
And then you did kind of touch on a few things about helping with the low blood pressure, but
Mhm.
is there an exercise that would help with that? Like, for example, a stationary bike. Is there something that could help exercise wise with the low blood pressure aside from adding
No,
salt or?
yeah. So there's no exercise that can help with low blood pressure. Like it's yeah, it's you really don't want to be living with really low blood pressure. I mean, some people have naturally like their blood pressure is on the lower end. And in fact, I feel like in that population of my patients, I struggle a little bit more with medication adjustments just because their blood pressure tends to be low. And often the more levodopa you tend to accumulate, that tends to drop that blood pressure down and just causes a lot of tolerability issues. But there's no exercise to drop your low blood pressure. Often high blood pressure can be a very good can actually improve quite a bit with a consistent exercise routine. So but not so much the other way. So low blood pressure would need to be treated by these other interventions that we'd spoken about earlier, including medications maybe.
And then since you did bring it up in the slides, it wouldn't be a
Hmm.
Parkinson's program if we didn't talk a little bit more about constipation. So,
Right. Yes. No. I mean,
I,
but I mean, it's common in the general population, and then you add Parkinson's to the problem, and that just makes it 10 times worse. So, yeah. So constipation, um, again, often with constipation, like a common thing that I hear is people always try something and oh, it didn't work, and so they try something else. But it's always about building a regimen with constipation. So, as a general rule of thumb, you need to be drinking lots of water and having lots of fiber in your diet. Things like prune juice, prunes in general can be very helpful. If you dislike prunes, which is very natural because prunes are, but try to mix them into smoothies, try to find other ways in order to kind of have high fibrous foods like chia seeds, bananas, like kiwis, like have lots of fruit and veg. So that should be your baseline. Like that's what you should always be doing. And if that on its own doesn't work, I recommend kind of adding on to that. So I usually recommend psyllium supplementation. So that's things like, I think it's still called Metamucil in the US, but it comes like over here, it comes as a capsule as opposed to that sludgy orange drink. And so that's been great because a lot more people are willing to try that capsule as opposed to the drink. So, taking any type of psyllium supplementation, whatever brand it is, adding that like can be a good first step. And if your high fiber, high fluid diet and the psyllium supplementation isn't helpful, then I add Restorelax, which is like or Pegalax or Pegalite. And the reason why I start with those two agents first is because they cause less dependency. So, and by dependency, I don't mean that you get addicted to it, but that your body gets so used to a lot of the laxatives that you end up taking that on a day that, let's say you miss taking your Senna tablet, you can actually get constipated, like unless you take it. So that's something. So with Metamucil and Restorelax, they're much less. They're like they don't have that dependency effect, and so those are the safe ones to start with. So let's say you're on like high fiber supplement, lots of water, and you're taking this psyllium supplement, and you're taking Restorelax, and you're still having constipation. Then I would add the other, laxatives like your Senna and your Dulcolax and things like that that you can either get at the pharmacy or you can speak to your family doctor about. But not uncommonly, I have to refer my patients with Parkinson's disease to a gastroenterologist just because they have like newer drugs right now, like prucalopride, and I forget the other one that begins with an L. I don't use that as much, but often like we start them on that as well. So they're kind of fancier medications that the subspecialists are more familiar with that can actually help with constipation as well. But again, you don't really just want to throw the kitchen sink of medications at constipation. This is kind of where again, exercise, movement, and all of that, and what you eat is just so important and can play a big role into like managing constipation.
Yeah, what you said had made a lot of sense when you talked about it, and you said like get you moving, and that will get your systems moving.
Yeah, because often if you sit down, and often it can be with anyone, like the more you sit down, I think a good example is when you come off a long flight, like you notice that you're kind of crampy and you feel really uncomfortable, and that's because you've just been sitting in this tiny seat for a long time. And so the lack of movement really does have a big role to play. And let's say even if you're not like physically mobile, you're not able to walk, say, you can always look up exercises online to kind of stretching exercises that you can maybe do on a wheelchair, or any kind of movement exercises that can essentially get your bowels moving. And a lot of it's posture as well, because people tend to kind of have this bent over posture that tends to happen just with advancing Parkinson's disease. And so that's kind of where the exercise, like even if it's stretching exercises, that if let's say you're not physically mobile, like and you're more in a wheelchair, those exercises would still be important in order to get your bowels moving. But like a warm compress or anything like that can also kind of encourage blood flow and peristalsis to help your bowels going.
And someone asked about magnesium supplements. Does that help with constipation?
Yeah, well, I mean, I like not as an individual like agent, it doesn't help, but it can at higher doses. So like at least at a 400 milligrams a day dose, magnesium can be good. Magnesium's a good supplement to take anyway because it's good for bone and muscle health. And often people with Parkinson's disease also experience more frequent muscle cramping at nighttime, which can affect their sleep. And so I not uncommonly just have to prescribe, well, not prescribe magnesium, but just recommend magnesium anyway. And so, but magnesium can be helpful, but if you actually have constipation, no amount of magnesium is going to really help you go. You probably need, like I said, like either the strategies are I recommended, or maybe seeing your doctor about getting on a proper laxative regimen.
I want to thank you for being here with us today. We've
Oh,
gone
no
through all the
problem.
questions, and you were wonderful. We're so grateful. Um, as always, we have a wonderful tradition here at PMD Alliance, our wave of gratitude. Thank you so much for being here, Dr. Sasikumar. This
Oh
was
God, no
excellent.
problem. Lovely to speak to you all. Thanks so much for having me. I really appreciate it.
Have a great
Good luck to
afternoon,
everyone.
everyone.
Take care. Bye.